if you're having low back pain, it's possible that you're having some issues with your psoas muscles. Now your psoas muscles attach to your spine, they run down through your pelvis and attach to the inside of your femur. They act as hip flexors. So any movement where your hip is flexing like that, your psoas muscles are involved. And the psoas is often overlooked, or your psoas muscles are often overlooked when talking about any back pain issues or muscle imbalances, postural imbalances. And so we're going to address them today with a quick exercise and see if we can help lengthen them out and allow you to feel some relief in your low back as you're experiencing pain, or just feel better posturally throughout the day. So with your psoas, a lot of the times the issue comes about with extended periods of sitting. And whether or not you're spending a lot of time sitting throughout the day, there are plenty of other ways that your psoas can kind of get knocked out of whack. And if one side is grabbing more than the other side, you're going to experience greater flexion in your hip flexors and more contraction in one side of your low back. And so we're just going to try to approach the back pain issue with a well-rounded and comprehensive approach. So the first exercise that you're going to do is going to be laying down on the ground. What you'll do here is you are going to kind of recreate, to an extent, dysfunctional movement patterns. What you're going to do is you're going to round your back, arch your low back forward so that you're out of a neutral position. From this overarched position, you are going to then flex in the hip. You might notice that that it might be a little bit difficult to do so as you're in this overarched position because you're already shortening the muscles there. So actively bringing your hip into flexion, and then what you're going to do is you're going to release the low back and then bring the leg down and then go all the way straight. Now you're lengthening everything out. You're going to re-arch your back, overarch it, or anteriorly rotate your pelvis, and then you are going to posteriorly rotate your pelvis, and then you're going to slide your leg back up and do it all again. So you're going to arch, flex at the hip, bring your foot down, release the back as you slide your leg out, and then re-arch, and then lengthen and tuck. Do that about 5 to 10 times on the affected side. And it won't hurt you to just do it on both sides. And so do 2 to 3 sets of that, 5 to 10 reps on both legs, and see if you can get some relief that way.